Today in North East London is what we're calling Perfect Day. What this means is that we have worked really hard with all of our commissioner colleagues and our primary care and community healthcare teams to ensure that we can take care to patients rather than having to take patients to an emergency department in a hospital unless they really need it. We've got teams of people who are helping patients to find the right pathway on the telephone, or if we dispatch a crew face to face and they've done an assessment, being able to refer them on to a community team rather than taking them to queue in an emergency department. What we hope to achieve by doing this is that more patients will be treated closer to home and that their experience will be enhanced by not having to go to hospital when they really don't need to.
Our health advisors here at 111, we answer the calls with our patients. With the Perfect Day, it's good because the paramedics, when they give us a call, the star fives, rather than them being in the queue, they're fast-tracked to speak to a doctor if they need one. We have doctors here, clinicians there. We now have the Paradoc mental health on site, which is all good for the 111 team, so we can all work together in one roof.
Today we've just been to our first patient, which was a 7-year-old boy with breathing difficulties. He has known asthma, but from our examinations we've been able to find that his breathing actually wasn't too bad, and we've called a GP appointment for him to sort of keep him out of accident and emergency. And yeah, his appointment was very quick. The GP was quick to ring back to us, so yeah, he's going to be sorted today.
Today I'm in the caller colleague desk for Perfect Day, and we're taking calls from staff in the North East of London to provide them with clinical support and decision making on where to take their patients. I've just had a colleague call me about a patient who had numbness in their hand. We were able to dispatch an APP urgent care to scene to assist them in their decision making skills. So it's early days, but it looks good so far.
We just went to a 49-year-old lady who had a 2-day history of right flank pain associated with pain on going to the toilet. We have saved an ambulance for this lady, and although she still ended up going to the emergency department, it was the most appropriate route of care for her after we spoke to her own GP.
So we were asked to come and see a 14-year-old boy who had some learning disabilities, making a transit to hospital potentially very upsetting and disruptive, and also logistically fairly difficult. And we were able to assess him at home, including doing some blood tests and a wider impression of his home environment, which made us confident we could help and leave him at home, which was really valuable for particularly him, but also for his family.
There was over 50 ambulances that we didn't end up sending to hospitals during the course of 12 hours. So a massive help to the wider system and a real big demonstration of what we can do and what we can offer. We're going to be working now to do a lot more analysis of those results to understand all of the benefits and also what we can learn and what we can perhaps replicate on the shorter term as well as the longer term from the Perfect Day to help us through this coming winter and give us ideas to develop further improved services for patients going forward. Thank you.